শুভ সন্ধ্যা। আজ সোমবার 8 ফেব্রুয়ারি 2021 সন। এখন ক্যানবেরাতে সময় রাত 8টা। শুরু হচ্ছে ক্যানবেরার 2XX কমিউনিটি রেডিও স্টেশন থেকে প্রচারিত সাপ্তাহিক বাংলা অনুষ্ঠান বাংলা রেডিও। এই অনুষ্ঠান প্রচারিত হচ্ছে কমিউনিটি ব্রডকাস্টিং ফাউন্ডেশন লিমিটেড ও বাংলাদেশ অস্ট্রেলিয়া অ্যাসোসিয়েশন ক্যানবেরার সৌজন্যে। প্রতি সোমবার এই অনুষ্ঠান প্রচারিত হয় FM ব্যান্ড 98.3 মেগাহার্টজে। আজ অনুষ্ঠান পরিচালনায় আছি আমি রাকিবুল শেখ। শ্রোতা বন্ধু, আপনাদের জন্য আজকের অনুষ্ঠানটি নেওয়া হয়েছে আলো এনলাইটেন্ড ওমেন ইনকর্পোরেটেড ওয়েবসাইট থেকে। আলো এনলাইটেন্ড ওমেন তাদের হেলথ ইনফরমেশন অনুষ্ঠানের ধারাবাহিকতায় গত 21শে জানুয়ারি 2021 ফেসবুক লাইভে এই অনুষ্ঠানটি প্রচারিত করেছেন। অনুষ্ঠানটি পরিচালনা করেছেন আয়েশা সামা শেখ এবং অনুষ্ঠানটিতে উপস্থিত ছিলেন এবং বক্তব্য রেখেছেন হেলথ কেয়ার অ্যাসোসিয়েশন ইনকর্পোরেশন অফ ACT'র মাল্টিকালচারাল লিয়াজন অফিসার এইলিন হাং। এইলিন অনেক উল্লেখযোগ্য হেলথ ইনফরমেশন দিয়েছেন, যেগুলোতে ক্যানবেরায় বসবাসরতদের উপকার হবে বলে উনি ধারণা করেন। এইলিন was trying to help people to understand how health system works in Canberra and how to move around it. কোথায়, কিভাবে, কখন, কিসের জন্য আমরা কিরকম ধরনের ডাক্তার এবং সেবা পেতে পারি সেই বিষয়ে উল্লেখযোগ্য কিছু ইনফরমেশন এলিন আমাদের জন্য শেয়ার করেছেন। শ্রোতা বন্ধু, আসুন আপনাদের মূল অনুষ্ঠানে নিয়ে যাই। আশা করছি অনুষ্ঠানটি আপনারা উপভোগ করবেন। অনুষ্ঠানটি ইংরেজিতে ধারণ করা।
Hello and welcome to the second episode of the Her Health series with Alo. I am Aisha Sheikh, your host for today's episode on the topic of navigating the health system, choosing the right service for you, with our expert guest, Yelin Hung. Alo's mission is to uphold and promote gender equality, women's leadership and empowerment, specifically within the culturally and linguistically diverse community of women. The core idea of today's episode is health literacy, defined as the skills and knowledge of a person to access, understand and use information about healthcare and how they apply that to their lives and make decisions to maintain and improve their health and well-being. If someone lacks sufficient knowledge and understanding to actively participate in their healthcare, it generally results in problems with managing a disease or illness and can lead to delayed diagnosis and worse health outcomes. In this context, Alo Enlightened Women hopes to bridge gaps in knowledge and accessibility for CALD women, which so often act as barriers to improving health. So now, I would like to introduce our expert guest, Yelin Hung, the Healthcare Consumers Association's Multicultural Liaison Officer. Her role is to hear the concerns and barriers of culturally and linguistically diverse communities and communicate them to ACT Health Services to ensure that these communities can get the healthcare that they need. Key to her role is helping these individuals understand the ACT health system and get the most out of their healthcare. Yelin has special interest in supporting disadvantaged communities such as new migrants and refugees who are struggling to settle and integrate well in the ACT. Hello Yelin, how are you today?
I'm good. Thanks, and I really appreciate and thank you very much for inviting me to your series of health literacy program that you have, and which is really important for our community.
Yeah, great. Thanks so much. It's lovely to have you here and lovely to meet you. So now I'll hand over to your presentation, which will be on how the health system works and how to move around within it.
So, using the health services and the ACT, if you're new in the ACT or you just arrived or even if you just moved from another state, it is really important that we learn our way around our health services, especially if you have children. As this particular series is called Women, as Alo Women is providing information and services for women. We would like to offer information and especially accessing the services, as I mentioned. We will be talking about the walk-in center, the health direct telephone line, and pharmacists, the chemist, and home doctor comes, and the emergency department as well, and also including the community health services. Do I change to the next section? As I mentioned, it is really important that we have this information. I just have a short quote from Alan saying that knowledge is power, information is liberating, education is the premise of progress in every society, in every family. I think this applies to everybody, not only our multicultural community, migrants, refugees, asylum seekers. I think this is for everybody. Even if you speak English, you might find yourself that it is hard for you to understand your way around when it comes to access health services. So by making the right choice at the right time, you can get the best possible treatment. It is important, as I mentioned, that you understand your way around. We provide this information depending on how services are changing. So we make sure that from time to time, whether there are changes in services, in locations, we provide this information as soon as possible. Next. So something really, really important that I focused is using the interpreter services. I'm going to emphasize in the next 3 slides about the interpreter services because as new arrivals, there are migrants, refugees, especially that don't speak the English language. And it is really important that they understand that they have, as a consumer, they have the right to a professional interpreter, and most importantly, that this is free of charge. We need to make sure that people understand that to access a service and you can't communicate in the language, they know that there is this service of interpreting, which I will continue explaining, that you can choose the language, the gender at no charge. You can request it either in person or face-to-face or over the phone. But during, just to let you know, during the COVID time, we are experiencing more phone interpreters over the phone due to COVID restrictions and limitations to be face-to-face. We want to make sure that people understand that the interpreter services are strictly confidential, and they use up this organization who provides the interpreter services is the government. They use professional interpreters. They are qualified, accredited, and using a professional interpreter can have safe for having risk with the different organizations and services that you access. So how do you ask for an interpreter? This is where we empower people with information. The more you know, the more empowered you are to make decisions, the right decisions for you. So you have the right to ask for an interpreter. So you ask the doctor if you don't understand. You ask for an interpreter. You can ask your GP, your general practitioner, your doctor. You can ask your specialist. There are all these specialists and doctors and medical practitioners are registered to provide people with an interpreter if they need to. This includes the dentist and different other services, private and public health services. So the organization provides this interpreter services is the Translating and Interpreter Services, TIS, T-I-S. So the number is there on the screen, is 131 450. So they are professionals, accredited interpreters. They have a big number, over 200, 300 different languages. Over the phone, there are some limitations face-to-face depending on the city. For example, in ACT, they have a limited number of face-to-face interpreters, but they always cater to make sure that they cover the needs of the people. Now, it is important that you request your practitioner or if you access any ACT health services, they can provide you, they print out these interpreter cards. I put a few samples of the mostly spoken languages in ACT. And what it says there, that you show the card to the, if you are asking your receptionist to have make an appointment, then you request an interpreter and you show the card and they will see what language you need. It's a free of charge. Please make sure that you request it. Now, the following service is the Health Direct. This is a telephone health service where you can have a nurse over the side of the phone, and what you get is the nurse assesses your needs and your issues, health issue, and they can even you can even ask to talk to a doctor over the phone if you need to. And of course, when it is an emergency, they will ask you to go to the nearest emergency department, to the nearest hospital, and they will look in the screen. They will ask you for your address, and quickly in the map they will show you where to go, or even they ask you to hang up and call an ambulance if it is necessary. The phone number is on the screen. Also, another important aspect of the health services is that many people don't know is that we have the chemist, the pharmacist where we buy our medications and prescribed medicines and over the counter. You can have advice from the pharmacist, and wherever you go, it is important that you, whichever pharmacy you go, it's important that you always go to the same pharmacist so you get to know your chemist, the pharmacist, and can give you advice and understand and have a file on a records of all your medications. They can also provide you with an interpreter over the phone if it is necessary. If there are medication information that can be printed in the different languages, if it is available, they will do it for you as well at your request. And of course, you can go and get advice for minor illnesses like cough, colds, sprains, rashes, flu shots, tummy sore, those sort of things that are not urgent, but otherwise, please go to the emergency close to you. And to make sure that wherever you are, make sure which chemist is open until late. There are few pharmacies in the ACT. We have in Northbourne Avenue. There's one that's open until 11, and there's another one in O'Connor and another one over Tadanon. So they're open until 11 o'clock. So it is a good way that if we get sick until about that time, we can go and still get some medication. Next. Right. I'm going to answer a question from a lady over the Facebook asking a question about the Allied Health Services, community services. So the ACT Health and the Canberra Health Services have different Allied Health Services. These are placed at the community health centers where you might live near one. So we have few around in ACT. We have in Gangalan, we have in Belconnen, one in Dixon, in City, and one in Tadanon. So the only thing you have to make sure that some of the services are located in one place, and you have to make sure that which services, but mostly they're all available, like dental health for children, youth, and adults, rehabilitation, aged care, and community care services. This includes community nursing and different other allied services like podiatric, diabetes services. We have women, youth, and children services, breast screening, and mental health services as well for children, adults, and adolescents, and some ambulatory care services, self-management, like I mentioned, like for diabetes, and blood. Also, they have blood taken lab, they collect the blood and they send it out. So these are some of the services, but please, you have to make sure that you inquire to the community health center's main line and to make sure if you are eligible for some of the services as well, and if there are some different areas that you can go to. Next. The other service that is being quite useful, and I heard that many people are having a good use of this one, is the walk-in center. The walk-in center works from 7:30 in the morning to 10 o'clock at night, every single day of the year, including public holidays and New Year's Day, and weekends, of course. This is a free service, and it is very fast. This is for people over 2 years old. Please make sure if you have issues with your child under 2 years old, attend to the emergency department, to the nearest hospital to where you live. There are treatment and advice for minor illnesses like cuts, sprains, abrasions, and minor common illnesses like flu. They can provide a certificate only for the day, sick certificate for the day, only for the day you attend. They don't do follow-ups on any of the health issues you attend to. And we have 5 locations, which is really good because they're targeting the different areas for when you don't have to go to the emergency, you can go to these places. We have in Dixon, Gungahlin, Belconnen, Weston Creek, Taganon, and Taganon. And so it is important that you understand that these are only between the hours 7:30 to 10 o'clock, but this is to alleviate that instead of going to the hospital for a minor illness or cat, they can do stitches, you can go to the walk-in center. So please make sure that you make a good use of this service, available in 5 locations. Thanks. Another service, and this is after hours services. I mentioned I was going to talk a bit about after hours because it is important what you access after hours as well. Usually you get very ill after 10 o'clock, and that's when your doctor is closed. So the service comes, which is Canberra's after hours locum medical service. This is a service. There are only 3 locations in the ACT. The first one is in Belconnen, at the Calvary Hospital in Belconnen, in Bruce. The other one is the Warden Canberra Hospital, and the third one is the Taganon Community Health Center. Please make sure all the hours they open between 8, and this is something that I researched, make sure that it's up to date. It's from 8 o'clock at night till 11 weekdays, then 10 a.m. to 11 p.m. weekends and public holidays. And make sure that you call the number on the screen, the 1-300-422-567 for an appointment. And make sure that there are fees that apply for the use of this service. And they provide access to after-hours medical services, and the patient can go directly to them, but also depending on the need, the doctor can come to you. Now, higher fees apply to this, but you can get Medicare rebate with this service if you have a Medicare card. This other one, the National Home Doctor Service, is very similar to CALM, the Canberra After Hour Locum Medical Service. The only difference with National Home Doctors is that they do bulk billing. So instead of paying upfront or they do it through Medicare, they do it with a bulk bill directly to the Medicare. So as I mentioned, this is an after-hours doctor's visit. They will come to you. You don't have to go to them. They will come to you. In the ACT, they have about 38 doctors. Of course, they have scheduled roster different days of the week, especially on weekends. And what happens is doctors go to you, they assess you, they look, and they can provide a prescription. And sometimes they carry some medication like painkillers, mostly, and no antibiotics, but they can prescribe you with antibiotics if you need to, until you get to see your normal GP the next day or in a few days, because it's always hard to get an appointment with a doctor, with your GP on the spot. So yes, they are in ACT. They are open from weeknights from 6 to 8 in the morning the next day, Saturdays from midday, and all day Sunday and public holidays. So, and the call center, of course, opens from 6 o'clock in the afternoon, in the evening, and Saturdays from 10 a.m. and Sunday and public holidays the whole day. So it is important that, especially when you have kids, important to have that information available. Next. Another important information is Lifeline. This can be very sensitive for people trying to access this information, this service. But make sure that we're reassured that this is a service that is confidential. It's open 24 hours, 7 days a week, and it's in service over the phone, where you can contact this number, the 13 11 14, and get help, get support at times when you have, for example, a lot of stress, a lot of things happening in your life, and you need to express yourself and drain that those feelings. This service can help you do that. They can also provide you with an interpreter. So what you do is you can call the number I gave you for the translation and interpreter services, and you ask for your interpreter in your language, and you give the number, for example, 13 11 14, and they call the number, and they it's a three-way telephone information. That way you can have your help in your language. Thanks. Okay, we come to the very almost end, a very important part as well of the different services we have in the ACT. We have only 2 hospitals in the ACT. So there is an emergency department at the Canberra Hospital in Walden. And please, emergency department, we encouraging and telling our members, our community, that emergency is not for an everyday healthcare, and it's not for a very minor healthcare. It doesn't mean that you're not going to be seen. You're going to be assessed when you first arrive, and you will be triaged, and you will be put in a waiting list to see, depending on your illness, if it's too life-threatened, you will be seen immediately. That's in Warden, and I show the map where it is located. Soon in few years, when the emergency department is ready, I will be showing again this information to show you where the emergency department is. Next. The other hospital is the Canberra Public Hospital, and again, emergency department is not for everyday healthcare. Please make sure that you attend, but it doesn't mean that you're not going to be seen. Just go, and you're going to have to wait for a little bit. This is at the Canberra Hospital in Bruce. The map showing where it is, and yes, the next slide is, you see, it is important how you access the services. It's a gradient how you access the emergency department, which aims to provide you with a high quality healthcare and efficient service as much as possible. And please make sure that you're going to be waiting to be sick. You're going to be wait a little bit long if the illness is not life-threatening, but you're still going to be seen. In the gradient there, I'll show how the emergency is increasing depending on the services. So you can see you have and lower the community community services, the community centers, where these are community allied services where you go for everyday minor illnesses and look after different other things. You can also call the Health Direct, which is a 24/7 helpline and helpline information. At the walk-in center, again, this can look after minor cuts, stitches between 7:30 and 10 o'clock at night. And then what you see in the middle, we have the doctor, your general practitioner, the GP. While you wait to see your GP, you still can go and see it. But if you have immediate to wait for your appointment, you have to go and see the pharmacist. You can get Health Direct. You can go to the walk-in center. You can even at night call the home doctor or CALM. While you wait to see if it's a real emergency and life-threatening, please call emergency, the 000 to go to emergency by an ambulance if you need to. Make sure that you call an ambulance and make sure that you understand there will be charges depending of your situation. If you are a pensioner or you are a holder of a concession card or a healthcare card, the fees might be waived depending on your situation. And yes, next is a weekly way to see how our health services work in different states, of course. If you go to Sydney or New South Wales or Victoria, they have all the different ways to access services, and it is which way you go. So by making the right choice and at the right time, you can get the best possible treatment, as I mentioned. And it is just with this information, you will find out the right direction when you need the right service for you or for your family.
শ্রোতা বন্ধু, আমরা আজকের অনুষ্ঠানের শেষ প্রান্তে এসে পৌঁছেছি। আশা করি অনুষ্ঠানটি আপনাদের ভালো লেগেছে। বাংলা রেডিও আপনাদের কেমন লাগে জানালে আমরা খুশি হব। আপনাদের মতামত জানাবার ঠিকানা হলো banglaradio@gmail.com। আমাদের অনুষ্ঠান ইন্টারনেটেও শোনা যায়। ঠিকানা www.banglaradio.org.au। শ্রোতা বন্ধু, আপনারা বাংলা রেডিওর অ্যাপ ডাউনলোড করা থাকলে আপনারা বাংলা রেডিওর অনুষ্ঠানগুলো আপনাদের মোবাইল ফোন অ্যাপেও শুনতে পারবেন। আজকের অনুষ্ঠানটির আমাদেরকে ব্যবহার করতে দেওয়ার জন্য আলো ল্যান্ডেনোম্যানের কাছে আমরা কৃতজ্ঞ। শ্রোতা বন্ধু, আপনারা যে যেখানেই থাকুন, সুস্থ থাকুন, আনন্দে থাকুন ও শান্তিতে থাকুন, এই কামনা করে আজ বিদায় নিচ্ছি। আমি রাকিবুল শেখ। শুভরাত্রি।